Welcome to the Heart of Health Equity. My name is Ashlei Rodgers. My guest today is the Executive Director of Native Ways, Carly Badhart-Bull. Go ahead and say hello to the people and introduce yourself.
Amitakuyipi iishkian wachiankapie, washichu ia Carly Badhart-Bull amakiapie, Dakota ia tokadaki maniwi mieye, Damakota bade wakanta wahemachie, wakpa ipaksha hemata hank bade oto otuinde watie. So I just said in my language, the Dakota language, hello friends and relatives. My name is Carly Badhart-Bull. In Dakota, my name is Tokadaki Amaniwi, or Woman Who Walks Toward the Future. I'm Dakota, citizen of the Flandreau Santee tribe, and I live in our homelands, our Dakota homelands of Minneapolis, also known as Bede Oto Otue, or City of Many Lakes, which is in Minnesota Makoche, the land where the water reflects the sky in Minnesota.
See, your intro just dropped a lot of knowledge, and I'm like, oh, didn't know that, and didn't know that. This is already starting off really good. I want to say, like, what Native Ways is. I know it's a whole bunch of organizations together, and tell us what you guys do.
I'm the executive director of the Native Ways Federation, and Native Ways' mission is to activate and expand informed giving to Native nonprofits in Indian country through donor education and advocacy. We were established by 7 well-respected, established national Native nonprofits with a shared focus on elevating the importance of directly supporting Native-led organizations and in strengthening the Native nonprofit sector.
And I always talk about this. We don't hear enough about the work that is happening in the Native community. It's kind of like, I feel in the US, it's very black, white, and brown. Like we only talk about Latinx, Black folks, white folks, and we rarely talk about your community. Can you tell us what's going on in the health equity space?
Absolutely. So, one of the reasons you don't hear a lot about us is because there's, this country has done a terrible job at educating folks about Native people. And one of the biggest barriers that we face is this issue of invisibility. And this is something that comes up across multiple sectors and issue areas. Our folks are often not included when it comes to data collection. If we are, we're in the other category or we're misclassified. And so, all of these things play into this equity issue. As a Dakota person, as a Dakota woman, I think about the obligation we have to these future generations, to the grandchildren that we're not even going to meet in this lifetime. And when we talk about issues, whether it's housing, the environment, education, we have this obligation to ensure that they can thrive as human beings and as Indigenous people, as Dakota people, for my future relatives. And that means having access to things like our Indigenous languages, having the ability to prayer and go to ceremony. It means understanding our connections to this land and having a healthy planet to live on. And so, we need to be asking ourselves, in this equity space, everybody needs to be asking ourselves, what kind of a future are we cultivating for the next generation? Because right now it's not looking so good for them. And when you look at our current justice systems, child welfare systems, education systems, economic systems, they're not working for us. And in fact, these systems that have been or were imposed upon many of us as Native people, they were never intended to work for us. We were expected to disappear. We are a people who were expected to physically, culturally, spiritually. That was the aim of colonization, was to assimilate or, physically even make us disappear. And in many ways, it still is. We're still feeling these impacts. There was a report that was funded by the Kellogg Foundation a few years ago, and First Nations Development Institute and Echo Hawk Consulting are the ones who did the report. But it was a national study. And they found that across the country, 40% of people didn't know that Native people still exist. They knew that we existed at one time, but we were considered in many respects a people of the past. And that comes up in lots of spaces. To feel visible is really, really important. And the best way that folks can support with these issues, as well as a number of other issues, again, from housing, climate justice, Indigenous people have the answers to address these challenges in our communities, but we haven't been provided the resources. In fact, we've had a lot of barriers put up in front of us to be able to effectively deal with them. And so, folks need to support Native leadership, need to support Native-led nonprofits, organizations, tribes, to do the work that we know needs to get done.
So people don't really think about including you at the table because they don't know that you even exist anymore, which is crazy. If you're not in like
Right.
certain states like Oklahoma where there may be reservations, whatever else, which is also problematic for multiple reasons. I wanted to talk about the barriers. What do the barriers look like? Because I don't think people realize, people are like, oh yeah, they have this land in this part of the country, they're fine. It's like, well, actually, sometimes they don't even have running water. They don't even have electricity. Like this is a problem during COVID. People are realizing these things are happening. But can we talk about that? Like, what is that? What do the barriers look like? And, now that we're in the middle of a pandemic, what has that done to your community as well? If you guys have been invisible, like what type of care are you receiving?
So the Native folks in this country have been disproportionately impacted by the pandemic, by COVID-19. American Indians, Alaska Natives are dealing with infection rates, depending on the reports that you look at, anywhere from 2 to 3 or more times higher than white populations. In addition, we're 4 times more likely to be hospitalized and nearly 2.5 times more likely to die as a result of COVID. And these disproportionate risks are they have to do with underlying disparities of health, social, economic factors, some of which we've already touched on. We don't even yet know the full impact of COVID-19 on our Native communities, in large part because of this issue of data, inaccurate, misclassified data related to our communities. And this is an important story that needs to be better understood and addressed and hasn't been talked a whole lot about, I think, in mainstream media. But Abigail Echohawk and the Urban Indian Health Institute, they've done an amazing job educating around the importance of collecting data in this space. And so I just want to put a plug out there, recommend taking a look at their website. They have a report titled Data Genocide of American Indians and Alaska Natives and COVID-19 Data. So, and they have a number of recommendations. So I want to put that out there really quick. Also,
make sure we include that link too, just so everyone knows.
Yes,
click on that.
That'll be great. It's a great report. They have basically they put together report cards state by state on how states are doing when it comes to collecting data in American Indian communities, and folks aren't doing so great. I also just wanted to add, we know that the pandemic has amplified these structural inequities that have existed for generations in our tribal and our urban Native communities. For example, we've seen communities with limited or no access to clean water to drink, much less effectively be able to wash their hands. We've seen communities where housing is an issue, where it's common for multiple generations to be living under one roof and where social distancing is difficult. And I want to add one thing that a little bit of education piece that I think can be helpful, because a lot of folks just don't know. These issues persist despite the fact that the U.S. government has an obligation to provide healthcare to Native people under treaty law. And this is something that a lot of people don't know. And I think it's really important for folks to be willing to learn this and come to understand this, that American Indian tribes and citizens, we have a unique political status in this country. It's not based on race. It's due to our existence as tribal nations, long before Europeans arrived on this continent. And the US government has a legal obligation, it's called the Federal Trust Responsibility, to provide services and benefits to Native people, to Native nations, and that includes healthcare. There's this myth out there, and this is something that's been a barrier, unfortunately, that Native folks get free healthcare. They might go to a state-funded program and be told, go to Indian Health Services, which has been historically chronically underfunded, and this isn't true. This isn't fair. In fact, access to quality healthcare, despite the existence of Indian Health Services, continues to be a huge issue in many of our communities.
I would love to say that I am shocked that the US government did y'all dirty, but I am not. Black folks are doing bad, but I feel like Native Americans are doing worse in regards to the other numbers of like diabetes, heart disease, and no one's talking about it. So when you're talking about systems, walk someone through, like if everyone's like, okay, you get free services with Indian Health Services, but obviously that's not happening. Not to point blame, but what does it look like? What does the Indian Health Service look like for a person?
Part of it is lack of, again, access. So a lot of our tribal folks live in rural communities, and it can be hard for them to get to healthcare facilities. And then once they get there, what's available to them? Because of the lack of resources, there have been very limited offerings. We're constantly hearing about emergency rooms getting shut down, whole hospitals getting shut down. When you look at the staffing, the folks who are working in these systems are overworked and underpaid. And part of that is, it's hard to live in tribal communities. We have issues, again, lack of housing, the rural environments. Some folks struggle with that. And so we struggle with finding these quality healthcare practitioners and with them sticking around. And so folks have to deal with a lot of practitioners coming and going as well, which is another.
There's a lot of mistrust or distrust in the community with the health system, period. Like we don't.
Oh, absolutely.
Doctors, we don't like, asking the right questions or whatever. So like, do you feel like that's also happening because of the history? I get it. So what does that look like? Or do y'all have the same trust issues like we do?
Oh, yes. Oh, yeah. The trust issues are huge, especially with, Indian Health Services. Again, even though there's many Native folks who work within these systems and are working to make them better, it's a federal entity and it's been incredibly under-resourced. And so there's a lot of trust. A lot of these trust issues do come up. There's running jokes in our communities around, like, if you're going to get sick, don't get sick before this date, because they know that that's when the money's going to run out.
It's the beginning of the year, not the end of the year.
Wow. Exactly. And so, this is, and people joke about it, but it's not funny at the same time. Like, we all have stories of family members who have suffered, who have struggled because of this. The wait times are often incredibly long. And so, the Indian Health Services is an important resource that needs to be better supported so that it can be as effective as possible in supporting our Native communities. And one of the things I also want to make sure we touch on is vaccination efforts, because
I'm going to ask about that.
I do feel like in Indian country, the lack of adequate care is a huge issue. Lack of access to quality care is a huge issue. And I also think it's important that we share some of the successes as they come up, because it's really important to help folks understand that in order to help our communities, you have to support Native folks to lead. So when you look at the recent vaccine distribution programming and plans, tribal health programs and urban Indian organizations were given the choice early on to decide whether they wanted their distributions to come through Indian Health Services or state systems. And some tribes chose to work with Indian Health Services, and some had established relationships with state systems and chose to work with them. Either way, recent data that's become available shows that Native folks are being vaccinated at a higher rate compared to other racial and ethnic groups. And this is something
that's huge.
This is huge. And these high vaccination rates are largely because of the tribal and urban Native leadership being provided the opportunity to take control in implementing vaccine prioritization plans, distribution strategies, and to meet the preferences and needs of their communities. And so this is key. This is a key takeaway. If we want health equity, we need to be getting input and direction from tribes and from urban community leaders. And we've seen some great success stories with the vaccine efforts in Native communities, which a lot of people don't know. And again, that's in large part because tribes have supported and built on existing trusted community resources to do this. Indian Health Services developed a vaccine distribution plan early on that incorporated input from tribal and urban community leaders. And so this is an example of the benefits that can come when you respect tribal sovereignty, when you allow Native communities to make decisions as how to best care for their citizens. While distributions under IHS have been advised to follow CDC guidelines,
Right.
like other folks, including prioritizing healthcare workers. So they've done this, but they've also deviated from the guidelines in some ways. And I think this is an interesting thing for folks to think about. For
Mhm.
example, a tribe might consider elders at a younger age, 55 instead of 65, for example. And so what ended up happening is that helped move folks through a little bit more quickly. With communities that have some of the lowest life expectancies of any other demographic, that's what makes sense for our communities. When you start with 75 and older, and your population isn't in that category, you're wasting time in some respects. And so folks did what made sense for our communities. And this is an example, again, of respecting cultural values. And it's also something that I believe helped to support broader community comfort with the vaccine. When they saw their elders being prioritized, when folks saw spiritual leaders, getting up and saying, I'm getting vaccinated, that made a difference for other folks to say, you know what, I'm going to get vaccinated too.
I appreciate you saying that, because it's very true. Like, making sure that the culture is included in the rollout plans of reaching these communities is important. Making sure that certain leaders are prioritized in the decision-making process is important. It's interesting, again, as we're talking about social determinants of health and other issues that have plagued the Native community, it's true, your life expectancy is a lot shorter than the mass majority of the US population. So why would you wait till 75 when you can start at 55 and get more people in? The bright spots, I wish more people knew about that. I didn't even know. Like, I didn't realize that you guys were vaccinating more people in your community than any other community, which is huge.
Some of these positive pieces, another piece, just to quickly share, non-Native communities are also benefiting from the vaccination efforts in Indian country. The majority of tribal clinics offering the vaccine were able to provide them to non-Native people as well. Often non-Native people were able to have access through tribal health clinics before they were able to have access through their regular clinics. And even though they weren't eligible for IHS. And the tribal leaders who I've heard speak to this have shared that they both recognized, the reasoning behind this is they had access to the vaccine, and they recognized that many of the households in their communities included both IHS eligible, both Native and non-IHS eligible folks. And so to them, it made sense to open it up to others, not to just stick to okay, do you check this box, kind of, by age or whatever, but also taking into consideration the environment and how to most effectively limit the continued spread. And they also spoke to how doing this, how by opening up vaccinations to non-Native folks in their communities aligned with the Indigenous values of being good relatives and good neighbors. And again, this is something that I think is really important to be shared. Many of these tribal communities, when you look at some of these, we call them border towns right outside of reservation communities, there's a lot of racism that happens and that exists. And so these stories about, folks opening the doors and non-Native people coming in and getting this kind of care, these are really important to share for a lot of reasons as we look forward, to where we're going in this country.
Why are we talking? This is not making the news. This is, again, part of your original point, invisibility. Like, this is important. That's huge. And things that, like, lessons learned from what you guys have done in these communities can be sprinkled on to other communities that are still having issues vaccinating their populations. We can learn so much.
Well, and it also goes to what I initially talked about when we were talking about even, the idea of equity and looking at the future generations. That's what our tribes and our tribal leaders are trying to do. They're looking at the whole picture. They're looking at how we're all connected to one another. And, this is one example, but if we could start, really listening to Native folks and Native leadership in other spaces as well, Native people will benefit, and that needs to happen, but other folks benefit as well. You look at the, climate issues and, environmental issues. Native folks have been saying we got to make changes for years, and folks haven't been listening. And now look at where we're at. We need to listen. We are all currently stewards of this land, and Native folks know how to take care of it, but we need the support to be able to make it happen so that we can do it together.
Can we talk about social justice for the Native community? What does that look like for you guys? Because I know you guys are helping us with, like, George Floyd, for example. I know we talked about this in the past. It happened literally down the street from where you live, and also where your organization is like headquartered. So, you know, you guys are fighting for us. Like, how can we fight for you guys? What does social justice look like for the Native community?
Social justice for us is being able to thrive, being able to live the way that we know we can and should be able to. It's having access to our languages, to our culture, to our spirituality. These are things that a lot of folks don't recognize or understand as being important to Native people. But at the same time, when you look at the aims of colonization, they were intentionally focused on these areas because they knew they were the heart of our people. And so, you know, things that folks can do: support Native people to lead, encourage Native representation at every table that you're at. Again, this invisibility factor.
And maybe this may be ruffling a few feathers, but it's true. White saviorism is a thing. And so sometimes people want to come in and swoop in and like help, but sometimes they do more harm than good. Other times they check a box or do good PR, and then that's it. What does that look like in terms of philanthropy? Like, how has that helped you guys? What has been harmful for you guys? And like, I know when people come in and like they have all the right intentions, but sometimes the intentions don't really work. Can we talk about that? Like, can we really talk about that?
We need to talk about that. Native people need to be supported to lead and to you know, have the ability again to effectively support our communities. We, as it's current, you know, as this structure currently exists, you know, the institution of philanthropy, we're often chasing those grant dollars like everybody else. You know, the criteria for how to obtain the grants, the strategies around the programming, around what's needed, often that is put into place before even talking to our communities. Often our communities aren't talked to at all. I mean, when you look at the data, so let me share a little bit about that. You know, pre-pandemic, less than 0.5% of philanthropic dollars were going to Native communities. Less than 0.5%. And so that's despite the fact that we're over 2% of the population. Right. So and there has been some shifts this past year. That's true. You know, we're not yet where we need to be. And especially when it comes to this philanthropy space. Now, when COVID hit, philanthropy responded pretty quickly. You know, we saw a number of foundations increase their giving amounts, including in communities of color and Native communities, because they saw that we were being disproportionately impacted. And so that's great. We saw a large number of foundations reducing their restrictions, both on existing and new grants, providing flexible funding so that organizations could adapt during these particularly challenging times. All of these are great things. At the same time, I've talked to Native nonprofit leaders who lost revenue they depended on because they weren't able to host fundraising events, you know, and things like that. In many cases, the philanthropic support hasn't made up for those losses. So it certainly, you know, hasn't caught us up to where we were. I do remain, you know, somewhat cautiously optimistic, I guess, because while I appreciate I greatly appreciate the increased support, I still have some concerns about is that going to be sustained, and not only sustained, but is it going to increase? Because that's what needs to happen. You know, and I've had conversations with a number of other folks around this issue as well. You know, is this a one-time philanthropic reaction? You know, I hope not. Foundations need to pay attention to the underlying infrastructure issues that resulted in our communities being disproportionately impacted by the pandemic. And just as importantly, philanthropy needs to support systemic change efforts that are led by and guided by Native people, so that our people can not only survive, but again, thrive in this post-pandemic world. We can't undo what's been done. We can't undo that colonization has happened. But we can choose how we move forward and how we relate to one another moving forward. We can choose to move forward in ways where we collectively ask that question of what is the future we're creating for the generations who aren't here yet. You know, what are we leaving them with? And we need to talk about this. We need to talk about how, you know, the facets of racism and white supremacy are so deeply embedded within our institutions, including philanthropic spaces.
Is there some other way that people can get in touch with you if they want to continue the conversation or work with Native Ways moving forward?
Absolutely. I will share my contact information so we can make sure to put it up on the blog. You know, one of the biggest things I want to lift up, the importance of supporting Native-led nonprofits and tribes. I know I've said it time and again throughout our call today, but I'm going to keep saying it. We need to support Native-led nonprofits and nations. And so if you're interested in supporting, but you're not sure where to start, looking up the organizations in your communities, reaching out, asking them, how can you help? Take a look at our website, www.nativeways.org, and get to know our 7 member organizations, you know, get to know their work. They're doing amazing work across multiple sectors.
I have learned a lot. I feel like I need to do some reading, like a lot of reading, because it's true, like we don't learn enough about your community overall, and we don't talk about enough in the healthcare space specifically. So I will be doing the research on all the links that you send me. I will be sharing those out with everyone.
Great.
I appreciate you taking the time to talk with us today. Like, this is great. And everyone, check out Native Ways. It's an amazing organization. You can actually move the needle by working with them. Thank you again, Carly. This has been really informative and great. Thank you guys for watching Heart of Health Equity. Tune in for the next show. Goodbye.